Yeah, my 5-year plan is to hopefully do my masters, do my prescribing, and then see what happens from there, really. But yeah, aim of the game, I'd quite like to be matron. Well, I started with St Austell Healthcare in 2015 as a receptionist, and then I got approached by one of the matrons here who asked me if I would like to become a healthcare, and that's something I've always been quite passionate about. So I went on a venipuncture course and started to train as a healthcare assistant. And then in 2018 I got promoted to senior healthcare assistant. And then I wanted to progress on my skills but sort of reach the level I could as a healthcare. So I got the opportunity to start my nurse training within St Austell Healthcare. So that was in the September of 2018. And then I've obviously been studying for the last 3 years on the adult nursing degree with Plymouth University. And yeah, I've just recently become a newly qualified nurse, and now I've started in a role with St Austell Healthcare as a treatment room nurse. I obviously had some care background previously before coming here as a receptionist, so it's always been something I was really passionate about. But yeah, just seeing the healthcares and the nurses doing everyday nursing tasks like blood pressures, ECGs and venipuncture, I was just oh, that's what I want to do that in time. And then obviously just been really thankful to have the opportunity to do it. One thing, I love being able to help, and especially in general practice, they're booked in for one appointment, say a blood test or a wound check, and then you get to know the patient, and then it turns to rumble. There's more depth into the appointment because they've got more issues, and then they feel they'd be able to speak to you about it. So for me, it's that being able to help the patient, being able to find pathways for them. Especially here now, we've got social prescribing and things like that. So if patients they're coming in and they're feeling a little bit depressed because they've just been recently diagnosed with diabetes and they want weight management and they haven't got support at home, then it's just signposting. That signposting for me is really important, and then that patient leaves the room and you think, oh, I've done a really good job with that patient. I think that's what it is for me within nursing. It's just making that little bit of a difference to somebody's life. St Austell Healthcare supported me by giving me the opportunity to go onto the degree because there was a funding from the government to be able to put me onto the course, and then the practice paying a fee towards the course. But then obviously they still had to support me by my monthly wage. So I had no student loans or bursaries or course fees to pay for. In general practice, it's really, really rare to progress onto a nursing degree. Obviously, big organisations like hospital trusts get good funding to be able to put students onto the degree, but within general practice, it's not really there. I know that we've got a few healthcares here that want to progress onto their nurse training, but it's just not reliable with the funding and stuff within general practice. But for me, I think general practice will really benefit from it, especially in Cornwall, because you get to build your own nurse, your own treatment room, your own practice nurse. So I think it's definitely something that needs to change within general practice for sure. It's been brilliant. From every single partner to every single nurse, every single GP, healthcare, everyone that works in St Austell Healthcare supported me throughout the whole thing from day one. And yeah, obviously without their support and funding, I probably wouldn't be where I am now, because I just wasn't in the right time of my life to be able to go and get loans and just do the degree. So to be given the opportunity from St Austell Healthcare, I would just be forever thankful for them, really. And obviously put my career now into good use for them, really, to bring my skills back to the table. Yeah. Obviously, once you're a nurse, it just opens so many opportunity doors that you can just do anything you want now. So yeah, it's brilliant. So yeah, my 5-year plan is to hopefully do my masters, do my prescribing, and then see what happens from there, really. But yeah, aim of the game, I'd quite like to be matron.